Welcome to our viewers on ASI News broadcast, bringing you the latest top news for today. Supreme Court gears up for Medicaid case. Healthcare providers have been long unhappy with often meager Medicaid payments, but whether they can actually sue states to raise those rates is a question the Supreme Court will consider Tuesday. The case Armstrong versus Exceptional Child Center is brought by 5 private companies providing Medicaid patients with in-home healthcare and other services. The firms say Idaho unfairly kept reimbursement rates at 2006 levels, even though care continued to grow more expensive. In response, Idaho, backed by 27 other states and the Obama administration, says it's up to federal government and not courts to decide whether states are obeying the Medicaid rules, and being forced to pay higher rates is a burden on its budget. Idaho argues. The state spent an additional $12 million on Medicaid in 2013 under order by a lower court. If the Supreme Court rules that healthcare providers may seek higher Medicaid payments via the court system, policymakers worry it will open up the floodgates to much more lawsuits across the country. But providers contend that courts offer the only realistic hope for higher payments. Doctors, hospitals, and clinics caring for the nation's poorest are paid at different rates depending on where they live, as states have lots of flexibility in how they run their Medicaid program. But the reimbursements are generally lower than for private insurance or Medicare, prompting many providers to turn away Medicaid patients and making it hard for them to find a doctor. And the problem could soon become more acute, with millions of Americans being added to the Medicaid rolls through the Affordable Care Act and the January 1st end of the law's 2-year Medicaid payment pump to primary care doctors. Appealing to state policymakers to bump up payment rates they've already set isn't typically very fruitful, said Jeff Miklos, General Counsel for the Federation of American Hospitals. Nor is it appealing to the Centers for Medicare and Medicaid Services, he said. Federal law says state Medicaid programs should ensure payments are, quote, sufficient to enlist enough providers, end quote, to make sure patients have access to care. But states with approval of CMS are able to decide for themselves what that means, and many have chosen to keep rates low. U.S. senators in Saudi, Qatar for talks on Syrian rebels. A delegation of U.S. senators led by John McCain have met separately with Saudi Arabia's Crown Prince Salman and Qatar's Emir, part of a regional tour focused on training Syrian rebels. As they met, hundreds of civilians fled rebel-held areas near Damascus that had been blockaded for over a year. Saudi Arabia and Qatar are staunch supporters of Syria's opposition, which is mired in a nearly 4-year civil war to oust President Bashar Assad. The meetings took place Saturday, a day after the Pentagon said that as many as 1,000 U.S. troops and support personnel would be sent to Turkey, Saudi Arabia, and Qatar to help train vetted Syrian rebels. Rear Admiral John Kirby, a Pentagon spokesman, said the training by a mix of U.S. special and conventional forces could begin as early as this spring. A message on the official Twitter feed for McCain, Republican from Arizona, said the U.S. delegation met with the commander of Saudi Arabia's training and equipment program and with Ahmed al-Jarrah, whom it identified as the president of the Western-backed Syrian National Coalition. Al-Jarrah stepped down as the SNC president in July 2014. The current SNC president is Khaled Khoja. The reason for the discrepancy in McCain's tweet was not immediately clear. The U.S. senators also met in neighboring Qatar with Sheikh Tamim bin Hamad Al Thani, the country's emir. The delegation included Senators Lindsey Graham, Republican from South Carolina, Joe Donnelly, Democrat from Indiana, Angus King, Independent from Maine, and Tim Kaine, Democrat from Virginia, the state news agency reported. All sit on the Senate's Armed Services Committee, which McCain chairs. In Syria, meanwhile, hundreds of civilians fled from rebel-held towns east of Damascus that had been blockaded for at least 18 months. Hundreds of women and children could be seen in footage aired by the Lebanese channel Al Mayadeen, sitting in what appeared to be a large courtyard. Those were the latest news brought to you from the American Studies Institute from Tehran. You can also check our website at www.asipress.us. Thanks for watching.